Hi, Dr. Edro Cero. What I'm going to be doing today is removing a toenail, and I'm going to be cauterizing the matrix, so basically the nail will not grow back. The toe's already numb now, and basically I'm going to be using sodium hydroxide as the matrixectomy. So what I usually do is I usually use a handmade or homemade tourniquet. There's a lot of aftermarket tourniquets, but I like this one because I'm not going to throw this away. You don't throw away instruments. So once my patient is numb, I use a hemostat and I loosen up the proximal nail fold superiorly or dorsally or on the top. And he unfortunately had a procedure already, so there's some extra scar tissue down here, but that'll come off as well too. Then I flip my hemostat and I remove the inferior margin. You doing okay still?
Yeah.
And as it starts to loosen up, you're able to dive down deeper and deeper. I love this procedure. Now once it's loose, I clamp down and I drop my hand. Success. Then get the other side. Drop it again. Success. The nail comes out all at one unit. All as one unit. Now that it's out, I'll inspect and see if there's anything else that needs to come out as well too. And also I'm using this opportunity to score the matrix. So a lot of times when people think about a nail that's growing, the nail actually grows at this base right here. So this is the part where we're going to put the chemical to make sure it doesn't grow back again. So I actually score or actually scrape the nail matrix or the nail roots with my curette. And this is the thing that really makes sure that we don't get any more nail growing back. Since you had a procedure before, I actually have to remove a little bit extra skin because a lot of your skin and nails become one. So I'm going to use my English anvil for that. Here comes my favorite part, where I get to put on my medication to make sure it doesn't come back. If you listen closely enough, you'll hear it sizzle. I'm just playing. So we make sure we put a lot in the corners because usually when people have parts of the nail grow back, it's usually in the corners. Still doing okay?
Yeah, good.
And this entire time, the patient is numbed up and doesn't feel a single thing. Now that we've burned or we cauterized the nail roots, we're actually going to reverse the chemical burn.
What reverses it?
Acetic acid. One last one. See how much better that looks? Sans the nail and sans the pain. So I'm going to start putting the dressing on. And this is when I start talking to my patients and let them know that this is a dressing that I want you to keep on for 24 hours. So you do not want to remove this. You want to keep it on. And after 24 hours, you want to soak it off with antibacterial soap and water. So you put your foot in a shower or you put your foot in a soap tub and you basically rinse it off and you pull it off underwater, otherwise it's going to be very painful. We usually use Adaptic and antibiotic ointment, sterile 2x2 gauze. And we wrap this with Coban. So leave this dressing on for 24 hours. After 24 hours, you'll soak it off with clean water. When you soak it off, you want to pull it off underwater. You can use Epsom salt too if you want to. When you're done soaking it off, you want to clean it with antibacterial soap and water and patch dry it. You do not want to rub it. You want to pat dry it. After that, you're going to soak this foot or this toe twice a day. So whether it's a shower, whether it's a foot soak, the toe is going to get wet twice a day for 5 days. On the 5th day, today is Friday, so next Wednesday, you won't have to soak it twice a day. Next Wednesday, you will not have to wear any antibiotic ointment. And next Tuesday, you don't have to wear a Band-Aid at nighttime. Typically, the numbing medication wears off in about 3 to 4 hours. At that point, in your next meal, you want to take some Tylenol or ibuprofen with that. If you have any questions, you can call us on our answering. Take care.